Hey everybody, it's Brian, physical therapist, and today I'm going to demonstrate for you an exercise called a shoulder walkaway. So walkaway is a nice way, we call it isometric, which means that we're firing the muscle but we're not moving the joint. Because a lot of times if we have rotator cuff issues or just shoulder issues and we move it, it's painful. So what we want to do is we want to get the muscle to fire but not irritate the joint. So isometrics, years ago an isometric was you're pushing in a wall or a door and it's just, I don't know. I'm just not a huge fan of that, so I like to make it more dynamic. So I've got my resistive band, okay, so I've hooked it around the doorknob, closed the door, and I'm going to show you there's 4 different ways we can do a walk away. Okay, so the first one, I'll demonstrate with my right arm here. So right arm walk away, the position will be the same for each. My elbow will be at my side, I'm in a 90-degree angle, and it's basically I'm walking forward. So when I do the forward one, I'm working the front of my kind of deltoid and the anterior bicep, or the front of basically the front of the shoulder. And all you're going to do is keeping your arm locked. You're just going to take a step or walk away or lunge, whatever you're comfortable, and then come back. So you're going to feel this thing wanting to pull you back. So by holding your arm and stabilizing it here, you're working the front of the muscle. And then slowly come back. You don't want to go too far and slingshot back, so you got to be careful. So you can either take a step or two depending on the length of the tubing, and then step back. Or you could just kind of lunge forward if you like. If you have some issues with your legs and you don't want to walk as much, it's just easier. Either way is fine. So you'll do about 10 of those, okay? And then we're just going around in like a square. So then if I face this way, so now I'm going to work internal rotation, or this part of my pec area. So again, my arm's staying the same way, it's just a matter of what I'm doing, okay? So now this one's a little bit easier to do either a side step or a side lunge. So I'm going to go to my left and I'm just going to do a little bit of a lunge. Again, my arm is here. I'm feeling things working here, but I'm not irritating the joint. And then I'm coming back, okay? So it's step out, lunge, step back. Again, my arm's not moving. It's just stuck here, okay? So the next motion, again, going around the square, is extension. So extension is this motion. But now we're doing it just basically walking backwards, okay? So I've got my right angle here. And I'm just taking a step or two back, and I'm feeling tension in the back of my shoulder. So this is walk away extension. And then the last one is external rotation. And I'll show you from the back view because then you'll see all the positions. So external rotation is probably the toughest one for shoulder. So I'm gonna get in this position. Okay, so this one's a little tougher, so a lot of times I like to just have people lunge on this one or take a step. Okay, so I'm here, I'm just going to take a step outward, and then I'm coming back to the start position. Okay, so and with this one, you want to make sure that your arm isn't coming across your body, because the tendency with this one, the resistance is going to pull your arm back across your body. You don't want that. You want to keep it locked at neutral, okay, which is basically this position. So every position, my arm is the same way. And you can do 5 to 10 reps depending on your comfort level, and then depending on the tension you need. So if you're having a little more trouble or post-operatively even, you can do a very light resistance. And again, you want to talk to your physical therapist prior to doing any exercises. But this is just a nice isometric routine that can be very beneficial for rehabbing the shoulder, or just exercising your shoulder in general.